This is Butabute in the lowlands of Lesotho, where Nurse Mwetke Motlatsi is based. Besides offering health services, she also trains other nurses working in various healthcare facilities in Lesotho.
As the clinical mentor, I go to the health centers and work together with the health center nurses on nursing duties, basically, and the activities that we have to do in regard to health care services to the patients. It also involves providing the trainings to the nurses, especially the new ones who come from the training straight to work.
Every day she has to travel far to get to those who need medical services most, especially those who can't make it to the nearest health center or hospital. The roads are in poor shape in this remote mountainous terrain, and the weather can be unpredictable. Nurse Mwetke's colleague, Olatunbosun Faturiyele, says their work is essential.
In all of this, we are fighting the #1 killer disease in Lesotho today, which is the HIV/AIDS pandemic. Lesotho is #2 in the world with high prevalence of HIV, is a hotspot of HIV. So ensuring that communities are reached with health care, also it's a way to ensure, to see that this problem that we are facing is attacked at the root of it, which is at the community itself.
After a few hours' drive, they reach their destination. Today, they've brought their mobile clinic services to the people of Rakutuane village. The medical team gets right to work.
I've quickly done the TB screening because, again, in this country, you have high prevalence of TB. Now, that's the importance. You bring comprehensive health care, and then you're able to leverage on that to also address the high prevalence diseases that we have in the country.
Nurse Mwetke uses this opportunity to educate young people about sensitive health issues such as sexually transmitted diseases and HIV/AIDS. She gives them advice on how to protect themselves and others. We were just talking about circumcision in our language, Sesotho. It helps prevent the spread of sexually transmitted diseases. The World Health Organization says male circumcision can help prevent the spread of HIV, but the procedure should be done by medical professionals in a properly equipped setting.
The diseases are there and they're being transmitted, but now access is another thing. You can just see the terrain. Yeah, they have to cross the rivers, go down the mountains and climb. And you can just imagine after such a pain of circumcision, I think it's going to be difficult for someone to walk such a distance back home.
The mobile clinic team will arrange transport for the young men who wish to undergo a safe circumcision procedure in a hospital. While Dr. Faturiyele is seeing more patients in the primary school of the village, Nurse Mwetke continues her health education with those still awaiting consultation. It will be a month before Mwetke and her team can come back again.